Joining us now is Dr. Ron Elfenbein. He's an emergency room doctor. Doctor, good to see you. Thanks so much for coming on this morning. Emerald Robinson pointed out earlier that this is refuted by the White House, but this model, the IHME model, one that we have been shown multiple times, now showing, according to this report, that these numbers double. What do you make of this? What would be making this number go up?
Well, I think the predictions, now these are all computer models, so nobody really knows what's reality and what's not. But the computer model is based upon opening up the country, basically people going back to their normal business and doing their normal things that they would normally do outside and interacting with each other. So the uptick from 2,000 deaths per day to 3,000 deaths per day is really based on the assumption that by June 1st, the majority of the country will be open for business.
At some point, do we believe any of these models we've seen, because they haven't proven to be true thus far from what we've seen?
Right. So that's a really good point. Computer models are computer models. They're only as good as the modeler that's designing them. So they're based on a lot of assumptions, and those assumptions either turn out to be true or not true. And as you just pointed out, the vast majority of the ones that we've been looking at have really been not true. So it's the best that we got is our computer models, but to rely purely on computer models is very difficult and not really a great idea.
Doctor, I want to keep it right on the scientific facts of the matter and what you've seen, but just in your experience, what have you seen so far? What are your thoughts on this and how we move forward with the coronavirus and opening up the country?
So I think, the emergency room volumes that I've seen are down nationwide, certainly in the ERs that I've seen, about 40 to 50%. I work in multiple emergency rooms, and that's what we're seeing in the ERs that I work in, and that's data that we're seeing across the country. When you look at opening up the country, so to speak, you really, these deaths, that's what this predicated upon, this jump from 2,000 deaths a day to 3,000 deaths a day. So opening up Wyoming, for example, or Hawaii is very different than opening up New York City, which is very different than opening up New York, which is different than opening up Maryland. Each state is very different. And I think the best indicator of when to open and how to open is from the boots on the ground for those people in those particular municipalities, states, counties, however you want to look at it. But there's no one-size-fits-all solution to this. So you got to really look at it from the local person's perspective, if that makes sense.
No, it absolutely does make sense. That's how we're going to be able to open it up. Again, as you said, one size doesn't fit all. A lot of problems with that in many states, one like Michigan as well. I'd love to talk to you again. That is Dr. Ron Elfenbein. Good to see you, sir. Stay safe. Thank you for all your hard work. Joining us now, Dr. Ron Elfenbein, an emergency room doctor. Doctor, good to see you back here. I want to bring you in on this study here and what you know here. Do you suspect that if we went back and we test similar patients from December, even November, there is a possibility we could see other positive coronavirus testing as well?
Yeah, that's a very good point. So what's really groundbreaking about what this study shows is that, if you look at what France is saying, is essentially it was a month before the first confirmed case, we have a confirmed case, the first known confirmed case, I should say. So it's pretty remarkable, and it shows just how infectious this thing is and how easily it's spread, because in December we were still talking about it being contained in China. So at this point now we're looking at, well, maybe it was in other countries, and certainly could have been in the US. I know people that I see in the emergency room that tell me, hey, I had symptoms way back when, maybe I had it too, ha ha ha, but maybe they really did, we just don't know. So it's entirely possible that this thing was spreading long before we actually knew it.
And that's an interesting point on the heels of New York Governor Andrew Cuomo speaking yesterday, or maybe it was the day before. I get it confused. But either way, he says that a lot of these, the folks that were infected that came to the New York area specifically were coming from Europe. And that some folks that were in China possibly went to Europe and flew out of Europe back to the States here. So they're all possibilities. I think, again, it's early, I'm sure you would say, Doctor, but this does open the doors for other possibilities.
Absolutely. And, the United States was very forward thinking when we shut down air travel from China. But we didn't shut it down from Europe. And as you pointed out, people were traveling back and forth from Europe to the United States, to Canada, to Africa, to Australia, to all the other continents. but we only shut down direct transfer from or travel from China.
Yeah.
But that didn't stop people coming in from other places in the world who were either exposed to it or multiple leg journeys. So, we definitely slowed it down, but we didn't stop it completely because of that.
Sure, and we eventually shut it down to Europe and all, but that came at a later date. I want to ask you,
Correct.
Yeah, I want to ask you too, Doctor. As we see, well, first and foremost, where are you? Where's your hospital at? Where are you located?
I'm in Maryland.
You're in
I
Maryland.
actually work in multiple emergency rooms in Maryland and in Delaware.
Talk to me about that. What are you seeing there in the ER? Are you seeing COVID patients? Are you seeing a rise? Are you seeing a decline? Are you seeing less PPE than needed?
Well, I'm really fortunate. Every emergency room that I work in, we have more than adequate PPE, and we've actually taken to. I own an urgent care also in Maryland, and we've used that as a sort of repository to collect donations, and we've been sending it throughout the country. We have excess of face shields and masks and things, and we've been sending it up to New York and Connecticut and places that don't have adequate PPE. But I'm very lucky. I have more than adequate PPE in every emergency room I work in. When you ask about what we're seeing clinically, across the nation, we've seen a drop in emergency room volumes by about 40 to 50%, which is pretty remarkable. But the people that we are seeing are way more symptomatic. They're way sicker than normally. So while the volumes have gone down, the acuity has gone way, way up. So we're seeing sicker people, but we're seeing less of them.
All right, before we go, I just got a few seconds for those states that are attempting to open up. Any glimmer of hope for them? Can you give them any advice? Ones that are maybe going out, maybe they're over the age of 65. They want to get out of the house. How can they do so safely, getting back to their routines?
Wear masks. Try not to interact as much as possible with other people, especially if you have comorbidities, diabetes, high blood pressure, heart disease. All these things we know put you at higher risk for having a worse outcome with COVID-19. So just be extra careful. I appreciate you asking this question. Be extra careful, wear your mask, stay away from other people, wash your hands as much as possible, and don't touch your face. And please just be really, really careful and mindful that this is still out there and it's very easily spread. We
appreciate you sharing that with us. Very important to stay safe. We want to take care of as many people as possible. Dr. Ron Elfenbein.
Absolutely.
Good to see you. Thank you, sir.